This is our agenda. So what is telehealth? According to WHO 2019, telehealth involves the use of telecommunications and virtual technology to deliver healthcare outside of traditional healthcare facility. Telehealth, which requires access only to the telecommunication, is the most basic element of e-health, which uses a wider range of information and communication technologies. So can you think about the healthcare which can access everywhere? In telehealth, the medical education scheme, homebound patient monitor, consultation from the doctor, clinical care, which we can access it anytime and anywhere. In various telehealth, we will focus on mobile health and in comparing the Hong Kong app and the China app. So let's see the IPO model first. In the input, which is the healthcare worker side, we have the camera and the microphone. And the process, the legwork, data conversion, encryption, and decryption is important. For the output, which is the patient side, we have the phone monitor, loudspeaker, and the microphone.
Now I'm going to talk about telehealth in Hong Kong. Doctor Apps is a mobile app which can be downloaded in the App Store through smartphone. It is funded with the support of the Hong Kong Charity Foundation. The major function is to provide professional medical advice through FaceTime, online medical appointments, provide knowledge related to common disease in Hong Kong, can search for doctor by district and specialty, and provide current A&E service waiting time of all Hong Kong public hospitals. From the latest data shown in the mobile app store, it's revealed that Doctor App received rating 3.8 over 5 based on only 33 reviews with both positive and negative reviews. Doctor Apps in Hong Kong. Doctor Apps provide online medical consultation. It is good that it provides online visual medical consultation and the doctor who participate in the conference is a specialty. However, online consultation only held on specific time and dates and only focus on specific medical concern. Moreover, the availability is low as you can only make visual consultation when doctor is online. More, Doctor Apps also provide health information related to common disease in Hong Kong, through articles and videos. The information is come from reliable source with lots of data support and mainly written by the professional. Also, it is presented in the form of videos which facilitate better understanding. Furthermore, the user can search the disease by their own symptom and make online reservation for some of the doctors through the apps. However, the information is just a reference which helps the user diagnose their disease in a more accurate form.
The Doctor App provides current A&E service waiting time of all Hong Kong public hospitals. The strength of this function is can instantly know the A&E estimated waiting time, and patient can choose the hospital according to their needs. For example, for severe case, they can choose the hospital with the shorter waiting time, and for minor case, or they can just go to some general practitioner nearby their district. And on the Doctor App, they also provide the list of the general clinic too. They can just go to there to seek for help. And for the weakness of this function, this do not provide immediately help for the patient. For example, there are no instant online reservations. So as mentioned, the Doctor App provides a search for doctor by district and specialty function. This can search for different kinds of medical professional, for example, the Chinese medicine practitioner and physiotherapist. And we can make online reservation through the app. And we can choose the doctor with the help of client's review as well as the location. And the doctor on the list is more reliable and ensure that they got a license of it. And for the weakness of this function, not all the doctors can make online reservation through the app, just some of them can provide this service. So let me conclude some strength of the Doctor App. It improves the accessibility of doctor consultation and health information in a safe, effective, and appropriate way. And regarding the geographical location of both the clients and the healthcare provider, for example, it can be more convenient for the people who is disabled. And Besides, it improves the cost efficiency by providing online consultation of the medical concerns and waiting time of the A&E service in the public hospital, and it decreases the chances of delayed diagnosis of the patient. It also brings the patient who is disabled or not able to reach the clinic more convenient, as I mentioned, and it minimizes the stress or worry by providing medical advice immediately for the patients. And on the app, it provides different kind of resources. For example, the videos and the articles, which is about the medical knowledge, and it's helped to promote the public service through the app. There are some weaknesses of the app. Its limited accessibility. Online consultation only held on specific time and data, and only visual consultation provided, which physical health assessment cannot be performed on the patient, for example, palpation and percussion, which lead to diagnostic errors. And for the most important, only Chinese version is provided in the app, which restrict the user group. And so we have come up some recommendation for the doctor app. They can try to employ some doctor or nurses for 24 hours online consultation and cooperate with more clinic and help the patient to make reservation through the app, and maybe home visit checkup for those elderly who live alone or disabled, and provide medicine and referral for them. And they can try to promote the app inside and outside the hospital and the clinic, and try to cooperate with the hospital authority and to let more people know about
To China, I would like to introduce an app to you, Ping On Good Doctor. This is a revolution app because it including the sub-healthy, and the treatments, including the in-house medication team AI assistant through the internet, including the e-commerce, doctor, hospital, pharmacos, insurance, beauty care, fitness, etc. So, it's set up a one-stop healthcare platform that develops an integrated suite of services. They recognize the need of the user both when they are in need of medical care and when they want to stay healthy. It's focused on offering online family doctor service empowered by AI assistant and in-house medication team to users who are looking for convenience and cost-effective healthcare solutions. Also, it offers a variety of offline service via the internet of healthcare service provider. They also cooperate with insurance in providing value-added service to policyholders that enable to the synergetic integrations of insurance and healthcare.
The app work. First of all, you have to describe the symptom. For example, you have some headache, and then the app will have the smart routine for you to list out the doctor, and you may have consultation with the doctor. The doctor may give you some suggestion, and after the suggestion, he will or she will suggest you to the case adjusted, referring to the hospital and the examination at a offline hospital. And let's see the latest statistic of Ping An Good Doctor. There are 300 million registered users, which is 1 in every 3 Chinese internet user is the user of Ping An Good Doctor, and the monthly active user is 62.7 million, with the average consultation hitting the 650,000 for the first half of 2019. And also, as shown in the iOS store, the Ping An Good Doctor had rated 4.3/5 based on the 19,000 reviews.
To tell about the Ping An Good Doctor. Ping An Good Doctor impacts the face-to-face interaction with patient, healthcare professional, or both. As it improves access to healthcare, people live in rural or remote areas. They just need to have a phone and download these apps. They can access care more rapidly. Medical consultation can be arranged easily than before. So, it costs a high efficiency to healthcare. The cost is inexpensive and the shorter time for healthcare, as to the cost of transportation and time, and people just need to stay in a local hospital or clinic without consulting a new healthcare provider. So, but how? I will show you in the next PowerPoint. These have a standardized electronic health record. People remain in the same healthcare systems. It can improve the quality of electronic health record. It's referred to the monitoring and delivery of service in patient home, improving a link to a hospital or a center that collect patient data, because these apps also, if you recognize this and log into the apps, they can have your personal general conditions, and they can share your data with the other hospital, and they can get your data easily and treat your problem as simple as 1, 2, 3. So people with chronic illness, particularly the elderly, telehealth can be a powerful self-management tool, because this app also provides some healthcare tips daily, and people can feel free to review or consult the healthcare professional regarding the medications. If you have some confusion about the medications, then just you enter the name of the apps, and the healthcare professional of the MAC information will be delivered to you immediately.
For the strength, it eliminated geographical obstacles, that the medication can be delivered within 1 day in most of the area. Secondly, it is relatively lower cost compared with the traditional method. Besides, it also provided electronic coupons that can further lower the price. Thirdly, it is time-saving, as no queuing is required. The service is open on a 24/7 basis. Lastly, the rating service and the specialty will be listed out so the service quality can be guaranteed and user can choose accordingly. For the weakness, it is heavily reliant on the advanced technology. The potential users are less likely to be the elderly. Secondly, the accuracy of the diagnostic test is in doubt, as the description is very subjective. It is also difficult to assess some of the patient's signs and symptoms, for example the smell of the patient and the internal sensations such as pain.
Suggestion for the technological incapability, P9 Good Doctor should hold a pop-up store for the elderly and introduce an app which is more simple for them to use. And for the wrong diagnosis, they should instruct the healthcare professional to ask the information in more details and encourage the patient to have the face-to-face video calls with the doctor, so that the doctors may know which area are you feeling painful and also how big is your wound. And for the comparison, both of the P9 Good Doctor and the Doctor app in accessibility, they are easily to access, which we can use the smartphone to download it and access to the app. And for the affordability, both of the apps are having a free consultation. The P9 Good Doctors is more cheaper for the further consultation, and the Doctor app, people should buy some coins to have the consultation with the doctor. For the popularity, the P9 Good Doctor have 300 million users in using it. However, for the Doctor app, there are not much Hong Kongers know the app. And for the social acceptance, the P9 Good Doctor have 62.7 million monthly active users, and the China people love to use the app and for the consultation to the doctor. And for the Doctor app, we cannot find the monthly active users, but we can see that it is 3.5 out of 5 in the weight or in the iOS store. People is fair in using the Doctor app.
For the target users, P9 Good Doctors also target on the whole part of China and Hong Kong, while the Doctor apps is only available for the Hong Kong people only. For the availability of the online consultations, P9 Good Doctors offer 24 hours consultations, and they even open in the public holiday, while the Doctor app is only available in a certain time frame, for example 10:30 to 12 o'clock in the morning, and the time frame could be vary in different days, and that will confuse the consumer whether the service is available at this moment or not. For the service diversity, they also provide different kinds of specialties, so they are both the same. Lastly, for the payment method, P9 Good Doctors offer alternative payment method, for example WeChat Pay, Alipay, and HealthCalls, while the Doctor app is only available in HealthCalls at this moment. Let's move to the conclusions. The telehealth consultation is not popular in Hong Kong due to the high accessibility to the local clinic and hospital. People can consult a doctor or can get the over-counter drugs so easily at the local drugstores. These kind of factors will affect the usage of telehealth consultation in Hong Kong. But China is in different cases, that the Chinese people may not be able to reach the local pharmacy so easily compared with Hong Kong. And that's explained the mobile health consultation in China is much more mature than in Hong Kong. To conclude, telehealth consultation will become part of our life in the future for medical consultations or tracking the follow-up. Although the usage of telehealth is not so popular in Hong Kong nowadays, we should not underestimate the development of it in the future by looking at the good demonstrations of the Ping An Good Doctors applications. And this is the end of our presentations. Thank you. And now we move to the Q&A sections. The first question will be, do you think the traditional consultation can be replaced by the telehealth consultation? And the answer is, the telehealth can 100% replace the face-to-face consultation, as many health problems need to be diagnosed by some investigations, for example blood taking, CT scanning, and MRI. Also, health assessment is very important. As we mentioned before, the pain sensation cannot be assessed by the telehealth consultations, so telehealth is only a source of public to get some advice. For the second questions will be, is there any function can be added on for the current telehealth system? And the answer is, it can provide different kind of disease checklists or tools for the users. If they got marks, maybe 5 out of 10, they should consult a doctor face-to-face or given advice on what kind of the checkup they need to perform. And what's more, provide some daily living tips for them to prevent sickness. For the final question, it will be, what kind of condition would you think the public choose telehealth consultation instead of face-to-face doctor consultations? And the answer would be, for the people who is disabled or being too sick to reach the general clinic, for example diarrhea, dizziness. Even for patients who don't have company to bring them to the clinic, would be more favor on the telehealth consultations. And again, that's our reference.